kung ano bang ano dyan, si Dr. James Franks
Doctor.
Williams. Doctor? Kasama ni
Doctor. Hanggang.
Jaga. Si Jaga at saka si KK.
So, Kikay.
KK at Jago. Ayan na.
Oh, ito na.
Ito na, actually.
Wait lang, let me open the door. Hi, Doc James. Good morning. Hi, I'm
Nice to meet
Kikay.
you,
Good
Kika.
morning.
Nice to meet you.
Doc
Good
James,
morning.
that's Tito Diego.
Good morning. Good morning, Kuya.
Good morning, Doc.
Kuya, I will introduce to you Dr. James
Thank
Frank
you.
Williams, and he is a chiropractor.
That's right.
Yes, that's Kuya Daniel over there.
Kuya.
Hi, Doc.
And
Good morning.
Doc, please sit down.
Oh, thank you.
There. Okay. You know, Doc James, I have a friend and she's having spinal issues.
Yeah.
And I think it's high time that she goes to a chiropractor.
Yeah.
Yes, there have been a lot of recommendations
Yes.
to seek help from a chiropractor who have been
Very good.
effective for some people.
Yeah.
What we want to find out, doctor, is what is the practice of chiropractic as compared to other methods like, let's say, the Dorn method or other things?
Sure. Well, chiropractic actually is a health science that is based on the diagnosis and treatment of spinal misalignments through manual manipulation, which means the doctor puts his hands on the person and causes the bones to be in the right position and to be mobile again. And that has a phenomenal effect on the health of the person because the spine is actually also aside from being the protection for the spinal cord, it's this distribution hub for the intelligence of the body, the nervous system.
And what should one expect during a treatment? And in terms of when should we seek help from a chiropractor? Do we have to have an injury or could it be preventive?
Well, you know, quite often people come into the office with pain, right? They'll have a problem, they'll have a fall, or in the case of the Philippines, quite often people have had problems for many years, if not decades. And so when they come in, they'll basically get an examination, and quite often I'll recommend some x-rays too.
So the people who come to see you, doctor, is they've been experiencing, let's say, minimal pain for a long time, and they come to you when they cannot
Right.
stand the pain anymore. Is it?
That's
your experience?
quite often the way it is, although not in each and every case, because sometimes what we'll do is we'll have athletes that are coming in and they want to improve their athletic performance. So we can help with their flexibility, their speed and coordination by improving their nervous system.
Doc James, I want to ask, who are the perfect candidates to go to a
Undergo the procedure,
yeah,
yeah.
to undergo the procedure?
Well, you know, chiropractic can be helpful for almost everybody, right? I think it's a great form of healthcare that, just like dentistry, you know, almost everybody would benefit from
Yes.
seeing a dentist because they have teeth, and everybody has a spine, so it's helpful to see a chiropractor.
So you don't need to wait for pain. But of course, let's give a little background of this practice. Not many Filipinos are familiar. But when did it start? When did chiropractic practice start? And in what country?
Sure. In the United States, in 1895, the creator of
1895.
chiropractic, yeah, so it's over 100 years old, 120 years or so, Daniel David Palmer was he had studied a couple of other different healing professions, osteopathy, and he also had been experimenting with magnets.
Okay.
And he had a fellow who was the janitor in his building come in, and this fellow had been deaf for about 17 years. And so Dr. Palmer examined him, and he found a bone that was out of place. And so the story goes that Dr. Palmer put his hands on Harvey Lillard, and he racked the bone back into place, and Harvey Lillard stood bolt upright and could hear the wagons in the street. And a watch ticking at arm's length. And so Dr. Palmer thought, wow, this is something special. And ever since then, chiropractic has been helping people.
Doc James, I just want to ask, do you understand Tagalog?
Kaunti lang.
Kaunti. So, do you mind if I speak in a few Filipino?
Not at all.
Okay, sige, yun naman pala eh. Baka mamaya medyo nagiging steam ako, baka mamaya kailangan maganyan din ako. Doc,
Yeah.
tatanong ko lang masakit ho ba na magpa-chiropractic procedure? Because I have never...
She's scared of having her bones cracked.
But I have friends who have already tried this and then they told me they felt so relaxed and light after.
Yeah, I've experienced it
But they
already.
told me, Doc, that during the procedure, they heard their bones cracked.
Right. And that's a little alarming for people, actually.
Is it dangerous?
You know, it's exceptionally safe. I've been practicing now for 20 years, and I adjust over 10,000 people a year, and there's never been a serious problem. You know, sometimes people can be a little sore if they have a lot of scar tissue that has to be dealt with to get them better, then they might be a little sore, but most people just really enjoy it and it feels good.
Yeah, and of course, I'd like to clear the misconception that if you feel pain in your bones or muscles, that's not the only time you can go to a chiropractor.
That's
I
right.
heard that you said it cured deafness, and then is it a cure also for migraines and other stuff?
It's excellent for migraines and other forms of headaches because it turns out that about 80% of all headaches are termed cervicogenic, which means arising from problems in the neck.
How about people who have scoliosis? Can they go to a chiropractor?
Chiropractic is very helpful for scoliosis.
So you just need one session or do you need multiple sessions?
It depends on the condition. So if somebody was to come in and they had lifted something heavy last week, well, then they're going to maybe need 1 or 2 visits because they haven't had much time for their body to continue to get more and more unwell. But if somebody's had a problem for 10 years or even 2 or 3 years, the ligaments change length, the muscles change tone, and even the brain will begin to rewire itself to accommodate for that injury. And so all of those things need to kind of be healthy again, and that takes some time sometimes.
Would you say right now, at this point in time, that your practice is an alternative for people seeking help, those who don't want anymore to get help from a doctor, or do you work hand in hand?
We work hand in
doctors?
hand because chiropractic is very appropriate for many things, just as medicine is, right? And so I believe, though, that when it comes to painful conditions, especially with the spine, chiropractic is an excellent first step because anytime you have a problem, it's best to seek conservative care before you seek something that is potentially more dangerous.
Doc, at what age do you recommend for us to consult with a chiropractor?
Well, as any age really is appropriate, sometimes even very young children can need chiropractic. In the case of, say, a baby who only holds their head in one position, or maybe only wants to nurse from one breast and not the other. So what has happened in some of these instances is the baby's neck has been injured during the birth process. And so even children can need chiropractic. And the elderly, of course, with problems like Kuba and you know, all the wear and tear that you can accumulate through life. Anybody who has a spine
So
can
you're saying
benefit.
the earlier the better, rather than have the long-term effect really cause a lot of problems later on when you're older, like these are headaches or the problem with hearing and other stuff.
Right, exactly. And also most chiropractors, and I know that this is the case for Mabuhay Chiropractic, and that is that we welcome people to come in for a free checkup. And we'll take a look at them and see if they actually have something we can help them with.
This is something you can do regularly.
It's generally recommended that even if you don't have much pain, that you come in, you know, perhaps every 4 weeks or something like that for a tune-up.
I'm interested, Tito Diego.
Yeah.
If Doc James can find your bones.
Yeah. Because right now I can't find my bones.
No, I'd like to ask also, so like, how about dislocations and other, because I've had friends
Right.
who were told to have an operation on their knee, but they chose to go to a chiropractor.
Right.
And it turned out that it was sufficient enough to cure them. How about things like these?
That's certainly true. Chiropractic generally is known for work on the spine, but we work on knees, shoulders, elbows, toes, anywhere where there's a joint.
Anywhere where there's a joint. Yes.
Doc
Even
James,
jaws.
our friends also from the radio, Kuya Daniel, Tita Angel, and Monica also want to talk to you. Kuya Daniel,
Okay.
hello.
Hi, Doc. No, I was just about to ask Dr. James there if it is possible for you to check Kikay now and then be able to know whether there's something wrong with her.
With her
Or
brain?
How do you, now
With her body.
broken brain or what? No, I mean how do you do the check? How do you do the checkup, Doc, for you to be able to know whether there's something wrong with somebody's bones or whatever?
Well, you know, a lot of it has to do with doing a proper history and finding out what sort of symptoms a person has. But generally what I'll do is I'll put my hands on a person. And because I've been doing this for as long as I have, I can feel things when they're misaligned or when muscles are tight. And I can
Can you
tell
do
a
that
lot.
now to Kikay?
Sure.
Sige na nga. Nakakaloka kahit natatakot ako, Kuya Daniel.
Ano?
Doc, please be gentle.
I will, I promise.
Nako, grabe. Kailangan
malaman
ma-increase
natin
ako nito,
kung-
Kuya.
Para
Ikaw na
malaman
nga bibigyan servisyo, ikaw pa
There we go.
maiklisan.
Oo, yeah.
Doc, I'm nervous. Is this
Don't
normal?
be nervous. Walang takot.
Wag ako matatakot.
Oh.
Oh, Tito Diego, hawakan mo ako.
Okay,
Be quiet,
so
be
right
quiet.
there, love. On the right, do you feel a difference? See, this moves well, but that on the right
Yeah, I'm
is
kind
not.
of having a hard time on the right
Yes.
side.
So the bones C1 and C2 on the right are not moving well independently to the right. On the left, not so bad. Then a little lower on the right again too, C4, C5. Let's take a look at your shoulders too, Kika.
Are they
Very
tense?
tight, love. Very
Does
tight
that mean I'm
muscles.
stressed, Doc?
Yes, I think you need a raise.
Yeah, I need a raise, Kuya Daniel.
Okay, well, we will raise you to the So from now on, your office will be on the rooftop.
It's a huge raise.
Thank you, Kuya.
So what kind of adjustment does Kikay need, Doc James?
Well, I would do an adjustment where she was lying tihaya, and I would adjust her neck with a quick movement, but a very short distance movement, to cause those two bones to be mobile again so that she feels comfortable.
I see. All right. So how long will it take for each session, Doc?
Well, the treatments themselves are very short, Kuya.
Oh, very short. No.
But the first visit takes some time because we have to figure out what's wrong with the person. So we look at all areas, not just the neck, low
Okay.
back, everywhere.
No,
And you also have to
do you
know
have a
what made
clinic
you
here in Metro Manila?
Yes, actually, I have a clinic, Mabuhay Clinic in Fairview Terraces, and we also have Dr. Tetrault, who's been in practice here in the Philippines since 2006. They have clinics throughout Metro Manila in Makati and Bacoor, Las Pinas.
And you also do home service.
We don't always do that. We can in special instances where somebody can't travel.
I see. Can you do that to a 91-year-old patient, Doc James, as well?
We work on people of all ages, Kuya.
Oh, I see. So how young is your youngest patient?
Well, my youngest patient was one that was just only a couple weeks old.
Wow.
Yeah.
That young.
Yeah, and that was the situation that I explained earlier, where the baby only wanted to nurse from one breast, and she just held her head like this.
I see.
And apparently, you know, when the doctor helped her to clear her shoulders, then something went wrong in the neck. The neck got misaligned.
All right. Thank you very much, Dr. James Franks, and we do hope that we can still invite you some other time and give us some sample of what you're doing with your patients. And maybe we can have Kikay as our guinea pig.
Walang
Pig,
ano-
literally.
Walang anuman po.
Thank you, Doc.
Thank you,
you
thank
po.
Do you sing, Doc James?
Pardon?
Do you sing?
Relatively poorly, kuya.
Welcome to the club.
Because I was about to ask Doc James if he can sing a Tagalog song.
Do you know any Tagalog songs,
Any Tagalog
Doc?
song? Ay.
Next time, kuya, I'll have one ready for you.
But are you familiar with some of our Tagalog songs here?
Not too much po.
Not too much. Okay. You better learn one.
We will teach you, Doc. Don't worry. We
Yeah.
know a lot.
Yeah.
Sweet.
You will love Filipino music. Thank you so much, Dr. James Franks Williams, Chiropractic Doctor. 6:45. We shall be back.